Yeah. You're on the sideline, somebody comes off, they have an immediate AC joint sprain. You're the person that's there. You see a potential step deformity and or just a lot of pain with motion in the shoulder. The athlete potentially is going to go back into play, but hopefully not, especially if you see a step deformity. But you want to stabilize that shoulder quickly. So we've got two pieces. Let me do the long piece first. You're going to come up the deltoid with a piece of the coverall, and you have to cover the AC joint. Then I'm going to take a shorter strip and come across the AC joint. Then you've got leukotape. I think I made that a little too long for him. Okay, and then you're gonna put pressure right on that AC joint to push it back down, because you have to stabilize that for him to have time to get to the orthopedist, okay? So this is one way. Old school ATC, if you don't have coverall and leukotape, you can just use your white athletic tape, okay? And you can even put multiple strips down to cover. But this was a great article that's still, it's an old one, but it's still good. It's still used in sports on the sideline to really stabilize. Now you could use this for somebody who's coming back from an AC sprain, who's got a little bit of a step deformity and you want to keep that in check. You can still do that for this athlete. Now if they're an overhead athlete coming back from an AC joint sprain, maybe this guy's a football player, rugby, doesn't have to be up here the whole time. But for baseball, tennis, lacrosse, all those swimmers, anything like that, probably not a swimmer because hopefully they didn't land on in the water improperly, right? But your field athletes and your court athletes, if they land right here, they're gonna potentially sprain and pop this guy up. So if it's a true overhead athlete, you're gonna take, just like we did on the hip, we took 3 and or 4 strips, and we're going to create an asterisk or a star symbol. You're going to do it with 75%, 50 to 70 to 100% tension out, because you've got to create the blocking technique. So you're going to hold it like this, stretch, and wherever that AC joint is creating the step up, you push it back down. Okay, and then you take your pieces off. So I had an athlete, he was a Brazilian Jiu-Jitsu player who sprained his AC joint. No step deformity, just pain, pushed it back down. And when he was ready to go back into to play and to compete, we did this one because it was so easy. He could still move his shoulders and get, do what he needed to do. But I wasn't really worried about the step deformity because he didn't have one. I was more worried about just keeping this stabilized, so that if somebody kind of squeezed him, that there would be some support for the AC joint, okay? And then again, just creating, like, press it down, creating that star technique.
How come you don't do the star with, like, the leukotape or?
You could.
Okay.
You could. That would be acceptable. You could do it here, and if I felt like I didn't have enough, again, you're not wrong to be like, let's add more, and keep pressing it down and then do another piece. Remember, this leukotape can go on the skin. It's just usually more customary to protect the skin in case, okay, that it shears off and it lacerates the skin. But the old what they called brown tape could never touch the skin. That would rip that skin right off. This is much more forgiving for the skin. So even if you didn't prep and you thought, you know what, I still need more, you could just layer this and don't even worry about adding those extra pieces of coverall, because you know that this is okay to be on his skin. So you can create the star like that if you felt you needed more support. Okay, a bigger shoulder might need maybe 3 strips to cover along that AC joint, and then start doing your pieces. Does that make sense? Okay, so that's AC joint. Very, very simple joint to tape, because there's not too much you really can do. You just got to think about compressing and stabilizing it. Okay? And then after you did this to your athlete, especially if there's a step deformity, most athletes with an AC sprain are not going back in. It's too painful. They take one more hit here. I mean, it's just going to be so painful for them. So they're most likely out. But you'll do this. You will stabilize them, and you'll sling them if you need a sling. And usually I have like a triangular sling in my kit, one of them, and then it's always there to be used. Or you can do a belt, right? I mean, you can get as creative as you need to based on what's in your kit. And you'd stabilize them and send them to make sure they just get to the doctor, ice them for the night. Whenever they can get in to see the physician, then they do. Okay, but most of the time a physician is going to be like, well, you've already got it taped, you've got it slung, okay, you have an AC sprain. As long as you're not on that borderline, right, where you really have a big step deformity, they're sending them right to PT. They're going to send them home, they're going to send them for rest and be like, activity modification, don't raise the arm, you got to let the AC joint heal. You'll do some gentle, active, assistive range with the wands and things like that. And then as soon as you can get them, then they're raising their arm actively, and then you're getting them into that resistive. This will heal very, very quickly, 3 to 4 weeks in their back. But that initial phase, there's not much you can do. You got to ice it, stabilize it, gently range it when they feel appropriate. They might give them some anti-inflammatories. That might help. But other than that, they're not going to do anything unless they feel it's really deformed up, posterior, or inferior, right? Those other ones we talked about. Those would be the 3 that would send the patient into surgery. Other than that, it's home for rest and then PT.